The broadcast is now starting. All attendees are in listen-only mode.
Okay, welcome to our monthly webinar. My name is Alan Cooley and I'm a project coordinator for Wellness, subbing in for Lori Benison. This month's topic is on smoking cessation, and it's called Stop Smoking for Optimal Performance. We have great presenters today. Our first presenter is Josette Cooper. She's a registered nurse in our disease management department at Lovelace Health Plan, and she's worked with members to quit smoking for 7 years. And our other presenter is Grady Richardson, who is also a registered nurse, and she currently manages the Healthy Steps coaching program, including the Stop Smoking Cessation program at Lovelace Health Plan. The Stop Smoking Cessation program follows the American Lung Association guidelines. Before we get started, we need to review some important information. Everyone is in listen-only mode. If you have questions, jot them down and email us at healthysteps@lovelace.com. If for some reason you get disconnected, don't panic. Simply call back in. The presentation will last approximately 30 minutes. After the webinar, we will send you an evaluation. Your feedback is important to us, so please take time to complete. It helps us and help you. So I'm going to pass off the duties here over to Grady.
Good morning, everyone. Welcome to our Stop Smoking Cessation webinar today. Today we'll cover the different aspects of quitting smoking, such as looking at why you smoke and why you want to quit. We'll talk about creating your quit plan and the medications that can help you. We'll also talk about staying smoke-free, the most important part of quitting. So why do you smoke? Is it a habit or an addiction? Well, actually, it could be both. You often hear the words, I can't break the habit, or it's a bad habit, but is it just a habit? It's actually both a learned behavior and a very physical and psychological addiction. People often start smoking and they create that habit. They smoke every day and they practice it, and before they even know it, they have actually become physically addicted to nicotine. So as I mentioned, when people start smoking, they practice it. Because you smoke one cigarette, you smoke another cigarette, you smoke it every day. It takes 21 days to form a new habit, so it doesn't take long before people have formed this habit of smoking. The good thing is that you can unlearn this behavior. You learn to smoke, you had to practice it every day, and you can unlearn it. So if you practice not smoking, you can form that habit as well. But smoking is also an addiction, a very physical addiction. It's also a psychological addiction. Long after the physical addiction passes, psychologically people still feel the addiction to smoke. They feel a very strong urge to smoke, even past the physical addiction part of it. And nicotine is a drug that produces dependence. So it is a drug. And it causes, once that drug goes away, you want to replace it. That's when you reach for another cigarette. So when you stop smoking, those withdrawal symptoms, you may feel restless, irritable. You just feel that very strong urge to smoke. But once you smoke that other cigarette, then you feel good again. So there's a physical addiction to this.
Okay. Why do you want to quit? Now you know why you smoke, but why do you want to quit? Sometimes people are ambivalent and not sure what they want to do. If you are not sure, write down your reasons to quit or not to quit and compare your choices. Once you decide to quit, keep your reasons for quitting handy so you can remember why it is important to you. So when you write down your reasons for quitting, you want to say, for example, I want to quit because I will save money. Also, maybe I will I will be healthier, live longer, I can play with my kids without coughing. Sometimes you also have barriers to quitting. A barrier may be that your friends and family smoke or all gain weight, and it makes it difficult for you. Begin deciding what you're going to do about each barrier. We'll talk about strategies to overcome your barriers. Most people attempt to quit 5 to 7 times before actually quitting. Consider those other attempts as practice sessions, and now you are quitting for the last time. The following slide also shows how much money you'll save if cigarettes cost $5 a pack. The savings are greater if you pay more than $5 a pack. Plus, you will save more with lower medical and dental care and even lower health and life insurance premiums. Think about what you can do with your savings. A vacation, kids' college fund, a car, retirement. If you look at, for example, if cigarettes cost $5 and you smoked a pack a day, in 1 month you can save $150. In 1 year you can save $1,825. Setting your quit day is important for quitting smoking. And once you've decided to quit, set your quit day a few weeks in the future. Give yourself about 3 weeks. This will give you time to develop your quit plan and build your confidence. Do you have any special events in the near future that would influence when you quit? Some people want to quit before a vacation. Some say they will quit when they return from a vacation. Do you want to quit on a Monday or quit on a weekend when you don't have to work? Pick what works best for you. Also, getting support is very important in quitting smoking. Having a support system really works. The more people that can help you, the better your chance of success. They help keep you on track. The Lovelace Health Plan Stop Program and the Stay Quit Line are individual telephone counseling programs that support your quitting efforts. Those numbers are shown on the screen.
Thanks, Josette. Part of that quit plan that Josette mentioned when you decide you want to quit is really important, and knowing your smoking habits. People don't even think about it most of the time, but when do you smoke? Which cigarettes are most important to you? Is it the first cigarette in the morning? Is it after dinner? Which cigarettes are the easiest to give up? You might start practicing with those ones. If you smoke during an afternoon break, you know, if you do something different during that break, is that an easy cigarette to give up? If you smoke while watching TV, what are you going to do instead? So start looking at when you smoke and why you smoke, and practice giving up the easiest cigarettes first. So the cigarettes that are usually most difficult for some people is that first cigarette in the morning or when they get stressed, which is another thing to think about. What triggers you to smoke? Is it when you get stressed? Is it when you drink alcohol? Is it when you drink coffee? Some people automatically smoke when they're in the car, so they're walking towards their car pulling out a pack of cigarettes. That's something to take into consideration. What are you going to do instead? So look at your smoking habits when you smoke, and then you can start developing strategies to use on your quit plan once you quit. So then you can say, when I'm driving, I'm going to do this instead. If I smoke when I'm on an afternoon break, what am I going to do instead? So the key is to learn new habits to replace the old habits. Learning new habits. As we mentioned earlier, it takes about 21 days to learn a new habit. So what you need to do is practice the new habits. For instance, if you decide that that first cigarette in the morning is one that you need a strategy for, then things to keep in mind might be to change your routine. What are you going to do instead? Instead of getting up and smoking that cigarette, you might get up and brush your teeth first thing in the morning so that you change your routine. But you have to practice that every day, and then it becomes a habit. So the same way that you practice smoking to build that habit, you need to replace that action with something else and practice that every day. Another thing to learn to do is to deep breathe. It actually works wonders. People don't realize that when they're smoking, they're deep breathing. They inhale deeply. It makes them feel calm, but when they stop smoking, they don't have that action of deep breathing. So when you deep breathe, it simulates the action of smoking and it calms you down. The great thing about it is it doesn't cost anything. You can use it anytime, anywhere, for as long as you want. Start practicing it now, so when you have that urge for a cigarette, you automatically start deep breathing and that urge will go away. Keep a list of strategies. Try them all, practice them, keep busy, chew something, gum, toothpicks. Just delaying the action of smoking will go away, but practice these things as you're building your quit plan. And once you quit, you have an arsenal of strategies to use.
Thanks, Goretti. Now that you've kind of got your quit plan together and got your barriers, your reasons for quitting, now you want to prepare for your quit day. You want to get ready. You want to plan your quit day so you'll be more successful. These are some of the things you can do to prepare for your quit day. For example, keep your reasons to quit nearby. Have your strategies in place like gum, hard candy, stress balls. Practice your strategies like deep breathing, changing your routine. If you're using any kind of medication, have it available. Throw away all your cigarettes and matches the night before. Maybe clean your car, deodorize it. But plan your day, your breaks and lunches, and plan your rewards. The important thing is to start thinking of yourself as a non-smoker. One good thing when you stop smoking is planning your rewards. Reward yourself often. You do deserve it. Quitting smoking is a hard thing to do. Rewards signify the hard work you have done. Sign a contract with yourself to not smoke for a specific amount of time. And when you achieve your goal, reward yourself. Buy a new outfit. Go to a movie. These are some of the things you can do to reward yourself for quitting smoking.
So now the tough part. Once you quit, oftentimes people feel irritable and have that very strong urge to smoke. People will call these withdrawal symptoms. We actually call them symptoms of recovery because they may feel bad, but they're actually positive signs that your body is recovering and going back to its natural state. They happen to everyone to some degree. Some people may have lots of them. Some people may, have milder symptoms of them, but they're all positive signs. Some symptoms, such as a cough, seem contradictory to quitting. People will say, I'm coughing more now than I did when I was smoking. There's a good reason for this. This is because the cilia in your lungs, those are the little hair-like structures in your lungs that keep your lungs clean, are actually coming back to life, and they're trying to sweep all that junk out of your lungs. So don't worry, it's only a temporary condition, and it is a good sign. When you're feeling some of these symptoms, things that you can do as part of your strategies is to make sure that you get exercise, get your sleep, drink extra fluid, and deep breathe. Most of these symptoms only last a few days. Some may last 2 to 3 weeks, but they are all temporary. We talked earlier about the psychological and the physical addiction. The physical recovery is the most difficult during the first week or two because you're experiencing those symptoms of recovery. But after that first couple weeks, those should be subsiding or be completely gone. The psychological recovery, though, may actually take several months or even longer. The psychological recovery process follows a grief cycle where people may feel angry that they quit or depressed or such, or they smell smoke and say, oh, I wish I could have a cigarette. But the thing is, it's not that you actually want to have a cigarette. It's just going through this grief cycle. Just know that it's normal to have these feelings, and you can quit in spite of your emotions. Now, we all know, as Josette mentioned earlier, most people quit 5 to 7 times before they actually quit smoking. So this is what we want to avoid and build into your quit plan. Sometimes you quit, you're doing well for a few days, and then you break down and have a cigarette. We call that a slip. A slip is just a mistake. It means that you probably encountered a trigger that you were not prepared for, or a situation. But having a couple of cigarettes is just a slip. The most important thing to do is to get right back on track and treat it as an emergency. You say, oh, that was a mistake, but I'm back on track. Don't give up. Don't label yourself a failure. It doesn't mean that you've gone back to smoking. Just treat it as a slip. Get right back on track. Now, a relapse is when you've actually gone back to smoking. Say, for instance, if you borrow a cigarette or two and you have and we call that a slip. The difference is if you go out and you buy a carton and you're smoking just as much as you were before, that's a relapse. Either way, just take immediate action. Remember why you wanted to quit, and stop it immediately.
Okay. The next thing we want to medications we want to talk about. Not every medicine is right for everyone. You may not be able to use some medications if you have heart problems, stomach ulcers, nasal problems, kidney or liver disease, high blood pressure, diabetes, or some mental health conditions such as depression. You may want to talk to your doctor about what is right for you. Also, check with your health plan to see if smoking cessation medications are available to you. Nicotine replacement therapy is available over the counter, such as nicotine gum, lozenges, and patches. Prescription pills are available, such as Chantix, Nicotrol inhaler, Zyban, or Wellbutrin. Again, talk to your doctor to decide which quit aid is best for you. When quitting smoking, people are concerned, they fear that one may gain weight. Some reasons for weight gain include eating instead of smoking, low energy, and increased appetite. Craving for sweets. Nicotine satisfies a craving for sweets, so some smokers replace smoking with sugar. Here are some tips to avoid weight gain. For example, exercise. Increase your intake of fruits and vegetables. Replace high-calorie, high-fat snacks with healthier ones, such as air-popped popcorn, raw vegetables, fruits. These are some of the things you can do to help prevent weight gain when you're quitting smoking.
Thank you, Josette. Another strategy to use when you quit smoking is assertive communication. Oftentimes, our well-meaning friends will say, "Oh, come have a smoke with me. You know you don't want to quit anyway," or "What are you doing that for?" And it's easy to give in. It's easy to go, "All right, I'll go have a smoke." But you don't. You don't want to do that. You don't want to give in. You want to just make sure that they understand that you have quit, and this is something that you're going to continue with. So you may just be very, be polite, be nice, but be very firm that this is exactly what you want to do, and you are trying to quit smoking, and you cannot go out with them. So there's different ways you can say it, but depending on who you're speaking to, you can use different methods. The most important thing you can do when you decide to quit smoking is to be confident. You have to think of yourself as a non-smoker. You have to remind yourself of all the tough things that you have actually done before, and this is just another one of those things. If you were able to do those other things in your life, you're able to do this. Really start thinking of yourself as a non-smoker. Oftentimes people will continue thinking themselves as a smoker who's just not smoking at the moment. But no, picture yourself as a non-smoker, your new life as a non-smoker, and that's just a part of your life that was in the past. It's not your future. When you think about perhaps smoking again, remember those first difficult days when you first quit, and realize, I don't want to go through that again. And so when you that may be enough to spur you on and say, nope, I don't want to go through that again. I've already quit and I've already passed that. So have confidence and remember that you can do anything you want to do. The first 3 months are statistically the most dangerous time of relapse, but if you stay on guard, if you know your triggers, if you know your habits, if you have strategies for every situation that you would have smoked in, then you can be successful. So recognize stressful situations and take action. Be careful about putting yourself in situations that may cause a slip. Sometimes people think, oh, I'm doing pretty good. I'm going to go out with my friends who smoke, and especially if you go out to a place where there's a lot of smokers or where there's alcohol. Alcohol often leads to smoking. It's difficult for some people to be able to drink alcohol and not smoke. That may be something you can do later on, but maybe it's be more difficult for you early in your non-smoking days. So think about that. Set future goals for celebrations and reward yourself. It's very important. The best reward to quit is something you can't, is something that isn't tangible. You can't actually go out and buy it and give yourself. It's your health. Within 20 minutes after your last cigarette, your pulse and blood pressure actually return to normal. So within 20 minutes, your body is trying to get back to normal. Within 24 hours of your last cigarette, your chance of a heart attack decreases. So almost immediately your health improves, and it continues to improve. Within a year after quitting, your heart disease, your chance of heart disease is half of what it was before. And within 10 years, your lung cancer rate drops almost completely to that of a non-smoker. So the rewards of your health, the rewards of quitting as far as your health goes, start immediately and continue on the longer you don't smoke. So that's something that that money can't buy.
Okay, this is Alan Cooley again. And Lovelace wants to make sure that members are knowledgeable about preventive screenings, recommendations for specific chronic illnesses, and general prevention activities. Information on this and the next slide is for both preventing health conditions and managing chronic conditions. So please take a moment to talk to your doctor about your preventive screenings in the left-hand column, as many of them are not a one-size-fits-all. The tests for chronic conditions listed are part of standard care, but it's always a good idea to discuss these with your doctor as well. So we'll stop for a moment to let you review the slide. This slide continues with more chronic conditions and recommendations if you have these diagnoses. The right-hand column lists other prevention activities we suggest our members participate in to get and stay healthy. So please take a moment to review this slide, and if you have any questions about any of this information, please feel free to email us at healthysteps@lovelace.com. Here are some complimentary resources offered to Lovelace Health Plan members. We offer telephone counseling for weight management, online health tools, including a health risk assessment in your health center, in our members-only section of the website, consumer health tools, health education, wellness discounts through our Choose Healthy program, and our monthly webinars about health topics. Go to our website at lovelacehealthplan.com, click on Online Member Options, and follow the login instructions to access these resources. It's also worth mentioning for smoking cessation, we do have the STOP program for you to take advantage as well by calling 505-727-5344 to get signed up. So thank you so much for joining us today. If you have any questions about our webinar, please email us at the above address healthysteps@lovelace.com. Remember to complete the evaluation you will receive via email. We really value your feedback as we use this information to improve our efforts to support you. And remember, check out our website regularly and register for upcoming webinars. Next month's topic is exploring common health diagnosis and treatments, and that will be on Wednesday, December 14th at 10 a.m. So we will see you then. Thank you.